Welcome back. As an Alberta Blue Cross member and emergency room physician, Dr. Shazma Mithani knows firsthand the toll that constant high-pressure work can take on both a person's physical and mental health. On this Wellness Wednesday, she is joining us to talk about overall well-being and why it's so important to prioritize your health. Thank you so much for being here today.
Thanks for having me.
So obviously, as an experienced ER doctor, you see firsthand exactly how important it is to take care of your health. So talk a little bit about that and how that has helped you.
So as an ER doctor, so much of what I see is actually preventable, which is why there is so much value that is placed on preventative health. So I mean, somebody that comes in with uncontrolled high blood pressure might have a heart attack or a stroke. Someone that comes in with uncontrolled diabetes could also have complications of that. And then in terms of mental health as well, for myself personally, emergency medicine is the highest burnout specialty that exists in medicine. And so that preventative mental health, physical health, emotional health package is really important to be able to continue to do what I do and take care of patients every day.
And so how has the Alberta Blue Cross Blue Choice Plan supported you?
In so many ways. I'm a pretty active person. I play ultimate frisbee, I play tennis, I run, weight train, and so physiotherapy has been great. Massage therapy has been great to help not only deal with injuries that come up, but any sort of, prevention or tune-ups that I need along the way. And then, of course, from a mental health standpoint, I've had a psychologist for many, many years. And with the Blue Choice Plan, as I joined it, I was able to keep my psychologist and keep that long-term relationship with her and continue to have that mental health prevention and tune-ups, as I like to say.
Now, you keep mentioning that word prevention, which I think is so important because really it is about trying to prevent things before they become emergencies.
That's exactly it. I mean, ideally, we don't want to see anybody in the emergency department. Somebody who has a good primary care doctor, somebody that has good kind of prevention around what they're doing means that they don't have to come in to see me because everything is optimized. They are living their best, healthiest lives.
Now, we often talk about women's health, especially I feel like in the last 6 months to a year, and the lack of information support that there is there for women's health. Are you seeing that? Are you seeing developments being made?
Thankfully, finally, yes. So for the last several decades, women's health research has been underfunded, really underrepresented. A lot of the information that we have about women's health issues is because of research on men, not women. And we're finally starting to have these conversations where we're seeing the importance and the differences in women, how we only, there are some diseases that only happen in women or are much more likely to happen in women. And so we need to have that data. We need to start talking about it more so that we can continue to treat women in the way that they deserve to be treated.
And does the Alberta Blue Cross support that?
Absolutely, in so many ways. There's this Women's Health Hub, a new online kind of portal where there is tons of information for women about different health conditions, lots of support, and you can just go there and read about so many things and learn about how Alberta Blue Cross is continuing to support women's health.
So what would your message be to viewers, not just women, but anyone, about when it comes to their health and I guess how to prevent themselves from ending up in front of you?
Having a good family doctor and then knowing that prevention is what's going to help you live longer. There's so much talk about longevity medicine and all these different supplements, but if you're taking care of the basics like sleep, mental health, physical health, these are the things that are going to have a massive return on investment down the road.
And because you mentioned it, because I feel like I'm overwhelmed with advertisements for supplements and take this, take that, what do you recommend people do if they're starting to see these and they think, oh, okay, I should start taking this? Or how do you do your research knowing that you're getting the right information? Or is it just talk to your doctor?
Talk to your doctor, but also know that if something sounds too good to be true, it probably is. We know that the research shows from a longevity standpoint that it's not supplements that are going to make a difference. It's preventative health, sleeping well, eating well, drinking enough water, staying active, moving your body, having a good social network, taking care of your mental health. These are all the things that actually have evidence behind having you live a longer and healthier life.
So focus on those more than anything else.
Focus on those things, exactly.
Okay, thank you so much for coming in today to chat about this. I appreciate it. We always love to talk about everything that you can do to make yourself healthier. And of course, for more information on Alberta Blue Cross, you can go to their website, ab.bluecross.ca, or their many social media channels that are listed there.